The spread of COVID-19 infection and children's mental health. What is a virus? It is very small and invisible to the eye. It is about 10 to 100 nanometers in size. 1 nanometer is 1/1000th of a meter. Viruses infect people and animals and cause disease. What kind of virus is a coronavirus? It is originally known as the cause of the common cold, etc. In December 2019, a novel coronavirus, known as COVID-19, was found to be the cause of a pneumonia that was spreading in China. You may experience fever, cough, nasal discharge, and other symptoms that you get in a cold. Children are as susceptible as adults, but the disease is less likely to become severe in children. However, children under 2 years of age, and those with asthma and other conditions, should be treated with caution. The diagram shows the typical progression of coronavirus. You can infect others even before symptoms appear. Even if you don't have symptoms, it doesn't mean that everything is okay. Infection is transmitted through droplets from person to person when they spit, cough, or sneeze. Infection also spreads by contact. The virus on your hands can enter through your mouth or throat. We can prevent ourselves from getting infected or passing it on to others by doing the following: washing our hands for 20 seconds or more, keeping a distance of at least 2 meters from others, staying at home as much as possible, wearing a mask, and ventilating the air regularly. The spread of COVID-19 began on December 31, 2019, when a pneumonia of unknown origin was detected in Wuhan City, Hubei Province in China, and was reported to the WHO office in China. It was later found to be transmitted from human to human and quickly spread around the world. The fight against this unknown virus brought sudden social restrictions and various official announcements. Everyone is feeling more uncertain and isolated than ever, and some adults and children may be overwhelmed by feelings of anxiety and helplessness. During this time, infections on the Diamond Princess cruise ship made headlines in Japan. On January 28, a patient with no history of overseas travel was confirmed to have contracted COVID-19. With the explosive spread of the infection, the Prime Minister asked elementary and secondary schools across the country to close temporarily from March 2 until the spring break. The Prime Minister declared a state of emergency on April 7, and the situation changed dramatically. Thanks to the efforts of the Health Department to identify and manage infection clusters, as well as the self-restraint that is practiced by most people, schools began to reopen with staggered attendance in June. At that point, the spread of the disease appeared to be under control. However, the COVID-19 infections began to rise again across Japan. With the spread of COVID-19 in 2020, schools were closed nationwide for the first time in our country. There are many news reports and awareness campaigns by various organizations about the mental health problems of children who are not allowed to go out in order to prevent the spread of the infection, but the actual situation is still unclear. There are concerns about the impact of COVID-19 on psychiatric care. Some research indicates that domestic violence and child abuse by fathers who have lost their jobs increase after disasters, and our country needs to be prepared for this possibility. In recent years, new issues such as internet addiction and gaming disorders have emerged, and many people have pointed out that children are staying at home and playing online games all the time. We need to consider the possibility that we are seeing healthy psychological reactions mixed with mental illnesses caused by unforeseen circumstances, such as the spread of COVID-19 and nationwide school closures. Potential problems include excessive anxiety and fear of COVID-19, not being able to see friends, and feeling more isolated due to the school closure. Game addiction, lack of exercise, and disturbances in the rhythm of life. While the number of consultations on children's mental health is increasing, there are only a few child psychiatrists and specialized medical institutions in Japan. With the spread of COVID-19 and schools closing and reopening, the environment surrounding children is changing dramatically, and the need for child psychiatric care is expected to increase. The combination of these issues may further complicate the issue of children's mental health. On the other hand, there are only a few child psychiatrists and about 30 specialized hospitals across the country. The Ministry of Internal Affairs and Communications recommends reducing the number of children with developmental disabilities who are waiting for their first visit to the hospital. The report on the work style reform for doctors also pointed out the shortage and importance of child psychiatrists, and the need to maintain child psychiatric care in the community. While the number of consultations on children's mental health is increasing, there are only a few child psychiatrists and specialized medical institutions in Japan. With the spread of COVID-19 and schools closing and reopening, the environment surrounding children is changing dramatically, and the need for child psychiatric care is expected to increase. The spread of COVID-19 will have a profound effect on our lives and on the mental health of our children. However, we do not believe that they are all abnormal reactions. Some may be healthy reactions to the abnormal situation of a pandemic. People grow up in groups, and it just so happens that participating in a group is difficult at the moment. We should be vigilant about COVID-19, while remaining positive about the changes in our children's mental health and promoting their healthy emotional development. With the outbreak of the novel coronavirus, our lives have changed dramatically. Schools have been temporarily closed, we can't see our friends, and many of us feel anxious about the sudden change. It is normal to feel anxious about this situation. Is there something that you are worried about? The spread of the novel coronavirus has changed our normal lives. We've been feeling more tired recently. We are unable to go out. We interact less with our friends. The way we work and earn money has changed. We spend more time together as a family. Both adults and children are stressed by the many changes in their lives. If you bottle up painful emotions, you may experience changes in your mind and body. For example, do any of these apply to you? I can't stop worrying. I feel sad. I try not to think about the coronavirus. I feel fidgety and restless. I'm frustrated. I can't sleep and I can't get up in the morning. I'm experiencing headaches, stomachaches, and other symptoms in my body. I can't concentrate on my studies. Don't stress out alone, talk to people. It's normal to feel frustrated by unusual situations. Sometimes talking about the changes in your feelings and body can help you calm down. Try to keep your life the same as usual. Eat well, sleep well at night, and get some exercise. Find out what you're able to do. Do household chores or come up with a daily routine. It does not have to be something special. It is also good to decide your responsibilities at home and divide the work that needs to be done. If you notice that your children are throwing tantrums more often, complaining of mental and physical discomfort, or are becoming more sensitive to sound, they may need to relax. What do you do when you're feeling down? You can listen to music, exercise, take care of animals, eat what you love, or chat with people. There is no bad method. When you feel down, the following methods may also be helpful. This is the 10-second breathing technique. Breathe in through your nose as you count 1, 2, and 3. Hold your breath at 4. Breathe out slowly from your lips while counting 5, 6, 7, 8, 9, and 10. There are simple exercises to relax your body. First, sit on a chair. Put pressure on both shoulders, pretend you are raising your shoulders. Hold that position for a few seconds. Relax your shoulders all at once. It is important to purse your lips and do a long exhale from your mouth at this point. Unlike long summer holidays, the school closures occurred suddenly. Due to the uncertainty regarding the future for both children and parents, it was difficult to plan homework assignments, go on family vacations, and for parents to take time off from work. Children were instructed not to go outside during the school closure, so they had nowhere to play with their friends, and had nothing else to do but to play video games at home. Of course, there are some children who were studying as well. With this change in their lives, we have heard many comments from outpatient consultations about an increase in sibling fights, an increase in irritability due to lack of exercise, and day-night reversal. Talk to your children about the novel coronavirus. What do they understand? With so much information coming from the internet and social media, it is not uncommon for children to have misconceptions or feel overly anxious. It is important to know how your child understands infectious diseases and how they feel about the changes in their environment. If your children are confused or have misunderstandings, work with them to make sure that they have the right information. Having the right knowledge can help to reduce undue anxiety. Share the fact that everyone feels the same way. In these situations, anybody can become restless, anxious, and frustrated. That is not weird at all, it is natural. When you understand the pain of another person and help them understand your pain, you will both feel better. Express your feelings in the right way. The worse you feel, the harder it is to relax. When you create the time and space to talk about your feelings on a regular basis, it becomes easier to express them in the right way. It is a natural reaction for children to feel more anxious in unusual circumstances. It is difficult to see the future in this ongoing tense situation, and the children may not even be aware of what they are feeling. A change in their emotions can easily manifest in their bodies. Look for changes in their mood, behavior, appetite, sleep, and other aspects of their lives. It is also a good idea to ask your children about the changes that they are feeling. These changes can actually happen, so it is important to create an environment where they can talk about those changes and their concerns easily, rather than rushing to resolve them. Of course, there are also positive changes. It's also a good idea to look for good changes in your family, such as having more opportunities to exercise together and becoming interested in a new thing. The key is being together, having fun, and repeating them. Relaxation works for adults too. It is surprisingly profound when you try it. At first, children may feel confused, but if you do it together and talk about how you feel, it becomes fun, and you can continue doing it for a while. You will feel more comfortable once it becomes a habit. Familiar places and things can calm you down, just like the way athletes always warm up before they start. Children act younger than usual, are restless, or cannot concentrate. Adults drink more alcohol or smoke more. Both adults and children may have difficulty sleeping, cannot get motivated, have headaches and stiff shoulders, lose their appetite, get annoyed, or become short-tempered. Due to these unusual days, it is natural to feel stressed. These reactions might be signs that you are stressed. Let's find out how to deal with stress at home. Have a regular life, for example, eat 3 meals, or go to bed and wake up at the same time. Relax with your 5 senses, for example, read books or comics, move your body by doing weight training, dancing, doing yoga, and so on, listen to music, watch movies, take a nice bath, and enjoy aromatherapy. Stay connected with family and friends, for example, be conscious of family conversations, and update your friends on social media. This is a stressful period that requires patience. Family time usually gets lost in our busy lives. This may be a chance to face each other and establish a new family relationship. Let's look back at the communication among family members. We can talk about how we feel about the situation at the moment. It would be good to share ideas on the overflowing amount of information. Children can also give us information from social media. How about assigning age-appropriate tasks to your family members? For example, opening the curtains, getting the newspaper, taking care of pets, cleaning the bathroom, etc. When deciding on tasks or rules, do not simply enforce them. Talk with your children and accept their opinions in order to nurture their independence. Praise them when they complete the tasks or follow the rules. Say well done, or thank you for helping, etc. It raises children's self-confidence and self-esteem. Try to do some household chores, such as cooking and cleaning, or work and play together. Through such work, we can learn to understand each other better. However, it can be highly stressful for family members to face each other. Adults should not get too stressed out and take a break. When the adults are relaxed, children become emotionally stable too. Adults should step away from the overflowing information once in a while and try to have a good time for themselves. We heard that many parents were concerned about their children staying at home and playing games all the time due to school closures, and they were worried that the children might become addicted to games. However, there were some children who got bored with playing games, and some children who wanted to see their friends. Kids used to fight with their parents to be allowed to play games, but even they have gotten tired of playing games with their friends while having voice chats. It shows that they feel the difference with face-to-face interactions and are unsatisfied. Our clinical data shows us that children want to meet people and talk with them. Are you having trouble with these things? For example, there is no school and the children cannot play with their friends. With more time spent at home or more free time, children might end up playing games all the time, or they may not be able to stop playing games and fight with their parents over it. Why do so many children become crazy about games? The brains of children are still growing and are not fully balanced yet. The function to take instinctive actions is stronger than the function to take rational actions, so children become addicted to entertainment more easily compared to adults. Games give rewards for achievements, so they get instant gratification. This leads to strong emotional ups and downs, such as when they win or lose, and when they succeed or fail. It is said that this can lead to addiction. The gaming world provides a strong sense of unity with friends who share a common interest. Children may find it difficult to stop playing games for fear of losing their relationships in that community. Children experience stress from a variety of sources, at school, and in their friendships and family relationships. When they feel anxious or depressed, they become addicted to entertainment, such as games and communication tools that can relieve those feelings so that they can continue their lives. During this period when they are required to stay at home, and there are fewer ways to relieve stress, it may be natural for them to spend more time playing games. Rather than trying to get rid of games, it may be a good idea to look for ways to work with them. Prolonged use of games can disrupt the rhythm of life, such as reversed days and nights, and disrupt the balance of your brain function. Specifically, the following problems can occur. Physical problems including headaches, fatigue, reduced physical strength, and reduced vision. Mental problems including lack of motivation and impatience. Social life problems including neglecting schoolwork and other hobbies, and not being as involved with family and friends who are not playing the game. What do we need to pay attention to? If you notice the following behaviors in the children because they focus too much on their game, take it as a warning sign, and consider consulting with a medical institution. You need to pay attention if they are prioritizing their game, or they are not sleeping, eating, or moving around much. Mental and social problems may be a result of prolonged use of games, but conversely, they may also be the cause of prolonged use, so it is important to pay attention to both aspects. How should the family members get involved? The main thing is to have a relationship that allows the parents and children to discuss and work together to solve the problem. It is normal to have different awareness between the child and other family members. If you simply nag or scold them non-stop, children will rebel or resist, which makes it difficult to talk about it. The key points of communicating with children are: 1. Do not blame them, listen first without criticizing. 2. Discuss the rules, respect their will and opinion. And 3. Praise them when they did something well. The government will continue to implement measures to contain the spread of the novel coronavirus. While children are coping with this new infection, we believe that we need to maintain our own physical and mental health from the following 5 points of view: understanding infectious diseases and the resulting distress, coming up with ideas on how to spend time at home, coming up with ways on how to handle games, introducing relaxation into our lives, and securing a local contact for consultations. Next, I will talk about coronavirus and our lives. The coronavirus pandemic has changed our lives dramatically. We have to stay at home and change our working habits, we cannot go to school or work, we cannot play, and we have to avoid the 3 C's. Our behaviors are greatly restricted, making life much more difficult. What happens when life changes? First, you will have to change the way you live. You will not be able to do the things you have always done, and you may feel more anxiety and stress. You may have less work or lose your job, and be in a very difficult situation financially. Your life becomes harder, and you may encounter psychological issues. Some of you may not be able to talk to anyone, and as a result, you bottle up all your feelings and become more isolated. However, in this situation, it's important not to worry by yourself. Talk to someone. There are places where you can get the right advice. We will provide you with a list of places that you can go to for advice and the systems that are available. There are various mental consultation services. There is an integrated contact point for mental health consultations and mental consultation services on social media related to the novel coronavirus by the Ministry of Health, Labor and Welfare. There is also Kokoronomimi email consultation service by the Mental Health Portal site for workers and Yorosoi hotline by the Social Inclusion Support Center. You can ask for advice through various methods, such as calling them or sending an email via social media. The following are consultation services for children. Childline, Children's Rights 110, Children's Rights SOS, 24-hour Children's SOS line, Child Consultation Center Abuse Response Line 189, etc. You can ask for help by email or phone call. If you are in financial trouble, the following measures are also available. The emergency small amount funds or general support funds are available to households that are facing a decrease in income as a result of the novel coronavirus. You can get sickness and injury benefits if you take time off work due to a sickness or injury, and there is also a public assistance system that you can use if your work is reduced or you have lost your job and you are struggling. You can use some systems that provide financial assistance according to your situation. You can ask for advice for jobs at Hello Work or job cafes for young people. The former has specific divisions, such as Young Hello Work for young people, employment consultation for foreign nationals, and Mothers Hello Work for those who want to find a job while raising children. Employment insurance procedures and job training mediation are also available. Last but not least, here are some places where you can get advice that we haven't covered, or if you don't know where to ask because your problem or concern is too complex. The first place is only for those who are living in Chiba Prefecture. It is called Core Community Life Support Center. This center provides support 24 hours all year long for all kinds of problems that you may encounter in your daily life, regardless of your age and identity. There is also a place called Self-Sufficient Living Support Center, where you can receive comprehensive consultation if you have financial difficulties. Lastly, the Basic Consultation Support Center provides comprehensive consultation for all people with disabilities and their families. We recommend finding the nearest place first and making an inquiry by phone. We have introduced various consultation services and systems, but there are many more that we have not covered. Please don't stress out alone and try researching for more information and asking for help. We hope your situation will improve from now on.